Hello, everybody. Hello and happy Monday. Let me know if everyone can see my screen, and we will go ahead and get started. All right, awesome. Yes, welcome everybody, new or returning, to another week of our ICD10CM Guideline Mastery sessions. I am Miss Haley. I'm going to be your lead instructor for this class, and I'm always so excited to have everyone here on a Monday night. I am here accompanied by my wonderful AMCI team. They are already in the chat and continuing to be in the chat supporting with any needs that you guys have. So if you have any questions or anything, definitely make sure and don't hesitate to ask those. And we are going to be beginning week 7 today. So we will be going over and reviewing some pregnancy complications, perinatal and congenital abnormality guidelines. So I'm going to be using, as always, our ICD10CM guideline book and also referring to our MCG manual as well in this session a lot. So make sure to have those both handy if you can. And we are going to stick to the same flow as we always do during this class. So we are going to warm up with our true or false Jeopardy game just to kind of get us acclimated or review those pregnancy guidelines. And then we're going to put those skills to use, and we are going to move over to our Quizlet, and we're going to do some more in-depth scenarios to really master those guideline skills. And I will also go over the true or false questions to show the guideline references so we can use this video as a review tool in the future. So without further ado, I'm going to go ahead and read our copyright really quick and get that out of the way. All right. So ICD10CM copyright 2026. American Medical Association, all rights reserved. Fee schedules, relative value units, conversion factors, and or related components are not assigned by the AMA, are not part of ICD-10-CM, and the AMA is not recommending their use. The AMA does not directly or indirectly practice medicine or dispense medical services. The AMA assumes no liability for data contained or not contained. ICD-10-CM is a registered trademark of AAPC. AAPC content found within this presentation is copyright of AAPC. Keyword concept, FTR, Chun, AMCI Fab 7, AMCI ICD-10, Flip, TAP, and MCG are trademarks of AMCI. The credentials CPC, COC, CRC, CPMA, CPB, CPPM, CPCO are owned by the AAPC. AMCI does not own the rights to these credentials. The credentials CCA, CCS, CCS-P, RHIA, RHIT are owned by AHIMA. AMCI does not own the rights to these credentials. Whew, all right. So we are going to jump right into it. I am going to stop sharing my screen just briefly so I can go grab that Jeopardy game that we were talking about. And if you're new here, these are all going to be true or false questions, and you are just going to be putting the answers directly into the chat. And I'm also taking all of these questions directly from our ICD-10-CM book as well as our MCG manual. So if you have those handy with you, that is where you will find all of those. So here are today's categories. We have our different chapters we're going, which is going to be pregnancy, childbirth, and the preparium. Then we have chapter 16, certain conditions originating in the perinatal period. Then we have chapter 17, congenital malformations, deformations, and abnormalities. Oh, I'm going to wait until my screen loads back, and then we will go ahead. Those are going to be the questions we're going to be doing today. Amazing. Okay. Perfect. Okay. Let's get right into it. So again, so that's what it was. Okay, so we're doing two sections are going to be from chapter 15, and then we'll do chapter 16 and chapter 17 just because there are so many guidelines in chapter 15. So let's start off, speaking of chapter 15, with a 100. Okay, True or false? Chapter 15 codes or O codes are used exclusively on the maternal record and should never be assigned to the newborn's record. True or false? I'll give you guys always about like 30, 40 seconds to put your answers in the chat, and then we will go over the answer. All right, that is going to be time. Amazing start. This one is going to be true. Notes definitely are exclusively on the maternal record. You should never assign them to newborn's record. That is 100% true. So everyone that got that one right, which I'm pretty sure everyone did, great job. Great start to the class. Let's move on to another chapter 15. Let's do a 200 this time. True or false? Postpartum is defined as the 6-week period following delivery, while the puerperium or the peripartum begins in the last month of pregnancy and extends up to 5 months after delivery. So postpartum versus peripartum, is this going to be a true or false statement? Let me know in the chat. All right. Everyone get those answers in, and this one is going to be... This is definitely the difference between postpartum and peripartum. So definitely good to know that when you see that in coding scenarios. So everyone that got that one right, amazing job. If we learned something, also outstanding. All right, now we're going to move to our chapter 16, conditions originating in the perinatal period. Let's move back up to 100. Okay, true or false? Only assign a prematurity code if the provider has documented it. True or false? All right, outstanding participation as per usual. So this one is also going to be true. I guess I'm just... But yes, this one is a given. As always, if the provider doesn't document it, you should not be coding it. We definitely shouldn't be making any assumptions, especially when it comes to the prematurity code used for the perinatal period. So outstanding job if you got that one right. Keep it up. You guys are killing it so far. Now we are going to move over to our chapter 17, our congenital malformations, deformations, and abnormalities. Let's do a 300. Okay, true or false? Use codes from Q00 to Q99 for documented congenital malformations, deformations, or chromosomal abnormalities. These codes may be assigned as the principal diagnosis only. Is this one going to be a true or false statement? Let me know in the chat, coders, and then we will go over it in just a few seconds. Alrighty. This one, we are going to have our first false of the warm-up game. So if you look inside the ICD-10 book or the MCG manual, you will see that in this guideline, it says to use these codes, documented congenital malformations, deformations, or chromosomal abnormalities, but you will also see that it says these codes may be assigned as a principal diagnosis or as a secondary diagnosis. And so that is what makes this statement false. So if you caught that one, great job. Okay, let's move back to our chapter 15. Let's do another 300. As always, put those answers in the chat. True or false? For cesareans, so cesarean deliveries, sequence the condition that led to the cesarean as the secondary diagnosis. So a sequencing question. We always love those ones. So let me know true or false in the chat. Alrighty, so this one is going to be another false. So it states that for cesarean, sequence the condition that led to the cesarean as the principal diagnosis. Statement. So if you caught that one, as always, outstanding. If we learned something, also outstanding. I appreciate everyone putting those answers in the chat. Let's move to A100, back to our chapter 15. True or false? Pregnancies in patients ages 15 and younger are considered young maternal age pregnancies, but are not classified as high risk. True or false statement? What do we think, coders? All right, time is up. So this one is going to be, now I'm picking all the false ones in order. I'm not doing it on purpose. Oh my goodness. So this one is also going to be false. So pregnancies in patients 15 and younger are considered young maternal age pregnancies, but they are going to be classified as high risk due to the potential risks associated with young maternal age. So again, that is what makes this one false. And if you caught that one, great job. And I will go over what specific guideline that I took these questions from. So if you need to go back and look a little deeper into these guidelines to get some extra practice, or if you had any questions after this, I will click through them. So definitely do not fret about that. Now we are going to move on to our chapter 16. Let's do a 300. Okay, true or false? If a condition starts in the perinatal period and persists throughout the patient's life, continue using the perinatal code regardless of the patient's age. Is this going to be a true or false statement? All right, we are back. So this is going to be a true statement. I was honestly, to be completely honest, when I was making these questions and I saw this statement, I was a little shocked or I was a little surprised. Definitely learned something when I saw this guideline. But yes, if a condition starts in the perinatal period, then you are still going to use that perinatal code through the patient's life. So definitely an interesting one. But yes, this is going to be a true statement. Now let's move on to our chapter 17. Let's do a 200. True or false? Use personal history code or codes if the condition has been corrected and is no longer being treated. What do we think about this one? I'll give you guys about 30 seconds to put those answers in the chat. Okay. So this one is going to be true. So you're going to use those personal history codes. You're definitely not going to still use a diagnosis code if the condition is no longer being treated. So that just makes sense. So this one is 100% true. Amazing job for those that got that one right. All right, let's close out this section of the chapter 15, pregnancy, childbirth, and the properium. True or false, assign gestation codes based on only fully completed weeks. So an example of this would be if someone is, 11 and a half weeks, are we coding 11 weeks? Or is it false? Are we going to code 12 weeks? What do we think? True or false? Okay, so this one is going to be true. So yes, especially when it comes to, gestation codes, you definitely don't want to be rounding up, just in case, there is some sort of complication. So definitely use the codes only on completed weeks. So yeah, so if someone again is like 11 and a half weeks, you definitely don't want to just round up to 12 weeks. So you want to go back and then do 11 full completed weeks. So that definitely makes sense. So as always, if you got that one right, great job. Let's close out our other chapter 15 code for 300. This is a long one. Okay. True or false? If a patient had a pregnancy complication earlier in their pregnancy, but that complication is completely resolved and not present when they come in to deliver, a normal delivery code cannot be used. What do we think about this statement, coders? Is this a true or a false one? Let me know in the chat. All right, time is up for this one. So this statement is going to be false. I didn't mean to give it away by really enunciating that not be used. But the reason that this one is false, if a patient had pregnancy complication earlier in their pregnancy, but the complication is resolved and not present when they come in to deliver, a normal delivery code or an 080 code can definitely still be used. So that would make this statement false right here. So if you caught that, great job. All right, we just got a couple left and then we'll move on to our in-depth scenarios. You guys are doing an amazing job. No surprise there. Let's close out our chapter 16 for 200. As always, true or false, the perinatal period for coding and reporting spans from before birth until the 60th day after birth. Specific guidelines apply to coding conditions and treatments during this time. So when we think of the perinatal period, what do we think about this statement? Is this going to be true or false? Let me know in the chat. Alrighty, time is up. So this statement is going to be false. I was trying to be a little sneaky as always. So I just switched one little thing. So everything about this statement is correct. The perinatal period for coding and reporting, specific guidelines applying to coding and condition treatment, but the perinatal period for coding and reporting spans from before birth. That is correct, but it is until the 28th day after birth, not the 60th day after birth. So that is what makes this statement false. So again, I just switched one little thing, and as always, I will go over the guideline that says this specific days. So if you caught that one, amazing. And now we are going to end on our chapter 17. Let's end on a great note. You guys have been killing it and on fire so far, so let's keep up that energy for our last question. True or false? Codes from chapter 17 may not be identified until later in life. Whenever it is diagnosed, it should be coded. So when we think of chapter 17 codes, what are we thinking about this statement? Let me know in the chat, and then we will move on to our guideline references. Okay, that is going to be time. So this statement is going to be true. So yes, so codes from chapter 17 may not be identified until later in life. Again, chapter 17 is going to be our complications, malformations, that kind of thing. So they aren't coded until later in life, and whenever it's diagnosed, it should be coded. So great job. Way to end the game on an awesome participation note. You guys did absolutely amazing. Again, always no surprise there. You guys always do great on these. I'm going to stop sharing my screen and move on to our PowerPoint. So again, we can see exactly what guidelines I used. I'm just going to click over them super quickly. For those of you guys who are new, This is going to be a recorded live session, so you can always find this video in the live section on our YouTube page. You can just scroll down, and when you find this video, you can take as long as you want, pausing to look at these specific guidelines. So I'm just going to go over them really quick. So this won't be the last time you see them. They're not gone forever. All right, so this is going to be from our first category, our first chapter 15, pregnancy, childbirth, and the preparium. As always, this is going to be our question followed by our answer and the specific guideline that I took the question from. This is going to be from our second category, so our second chapter 15, pregnancy, childbirth, and the preparium, question, answer, and guideline. This one says MCG manual just because I specifically got this wording from the MCG manual. It didn't have a specific number, so that is why it says that, for just to clear up any complications. This is going to be from our chapter 16, certain conditions originating in the perinatal period. And then last but not least, this is going to be from our chapter 17, congenital malformations, deformations, and abnormalities. Okay, so now that we are done with that, how are we feeling? Let me know in the chat. Are we feeling confident? Are we learning some things? Let me know. I'm going to switch over while we are typing those. Switch over to our Quizlet. So we're going to do 3 in-depth scenarios, and we are going to break down those scenarios into 3 different parts. We're going to break it down into our keywords, and then we're going to break it down into the guideline that we're going to be using to find the codes, and then last but not least, we are going to find those ICD10CM codes that best describe this scenario. Okay, so this is going to be our first scenario for the night. So a 31-year-old woman who is 28 weeks pregnant presents to her obstetrician for a routine prenatal visit. The provider documents gestational diabetes mellitus in the second trimester. The patient's blood glucose levels are being managed with a combination of dietary modifications and daily insulin injections. So what keyword or keywords best describe this encounter? As always, put your answers in the chat. I'll give you guys about a minute and a half, and then we will go over it together. All right, it is about that time. So if you're in the middle of typing, still put those keywords you think in the chat. But the ones that I am taking out of this scenario are going to be the gestational age, so the 28 weeks pregnant, the gestational diabetes, and then that diabetes being managed with diet and insulin. So if you got any of those, everyone's usually on the right track or pretty much exact when it comes to these keywords. So awesome job. Keep it up. And now we are going to move on. Now we are going to move on. We're going to do the same scenario, but now instead of doing the keywords, we are going to pick out what ICD-10-CM guideline best describes this encounter. So this is going to be from our chapter 15. Let me know what we think in the chat just to kind of narrow it down. It'll be from chapter 15. You can either put the number or you can put the title, however you want to do it, but I will give you guys about a minute and a half for that. Good luck. codes. So using those keywords, using that guideline as tools, what code or codes are going to best describe this encounter. And then as always, I will switch over to our PowerPoint so we can see how the keywords, guidelines, and codes all come together. Good luck. All right, I will not give the answer away just yet. I'm just going to stop sharing my screen and go over to our PowerPoint. So definitely still continue working if you are doing so. Definitely put those answers in the chat, what we think it's going to be. Okay, and now that we are back to the PowerPoint, this is going to be our scenario. And what we're taking out of here, like we just went over, is going to be that 20 weeks pregnancy, so 28 weeks gestation, the gestational diabetes, and then that gestational diabetes being managed with diet and insulin. And then this is going to be our guideline. It's just, I took the clip directly from the MCG manual, so this is going to be gestational or pregnancy-induced diabetes. This is going to be the whole thing. I had to do 2 different snippets because it's just a super long guideline. But as always, you want to look at our sequencing suggestion. That's usually going to be located in the right column. So you can see right here that our first suggestion is going to be a code from the category 024.4, which is going to be that gestational diabetes code or selection of codes. It even gives you a little options. So that is going to be our first code. So if we go into our ICD-10 book, we'll find that the most appropriate code for this scenario is going to be 024.414, which is going to be gestational diabetes mellitus in pregnancy, insulin controlled. And you can see right here that there's an option for diet controlled and there's an option for insulin controlled. I know in the keywords it says that the diabetes in this situation was managed with diet and insulin. So if you go down here again to the sequencing suggestion column, you can see right here treatment and specific codes, and right here it says if the scenario says gestational diabetes controlled with diet and insulin, it says to code only for insulin. So again, that's going to be that 024.414 code, and that is why I chose that one instead of choosing the diet controlled or using both of these codes. So that's the reason that that is going to be our first code. And then we are going to go back to our sequencing suggestion at the top, and then it is also going to require us to provide how many weeks gestation that our patient is. So if we go to our keywords once again, you can see that it is 28 weeks pregnant is how long our patient, or how far along our patient is going to be. So if we go into our ICD-10 book, we will find our second code for the scenario, which is going to be Z3A.28, and that is going to be for 28 weeks gestation of pregnancy. And then those are going to be our 2 and final codes to solve this scenario. So if you got that one right or you were on the right track, outstanding, outstanding. And if you were a little unsure about how to tackle this scenario, I really hope that the explanation made sense. Let me know in the chat. And again, if we have any questions, definitely don't hesitate to put them in the chat and we can go over them. So I'm going to stop sharing my screen and switch back over to our Quizlet, and we will go over the second scenario for the day. And we are going to start right back from the top, and we are going to be choosing our keywords, and then we will go into our other 2 parts after that. So this situation, or this scenario, I cannot talk today. A female infant is born in the hospital by uncomplicated vaginal delivery at 40 weeks gestation. During the newborn examination, the pediatrician notes syndactyly of the second and third toes of the right foot. The infant is otherwise healthy and requires no treatment during the birth hospitalization. The provider documents that the condition will require follow-up with a pediatric orthopedic specialist to determine whether corrective surgery may be needed in the future. Which keywords best describe this encounter? I know this is a long one, so there might be a lot of keywords. So let me know in the chat what we think they are. I'll give you guys about a minute and a half. All right, I know it was a lot to type, so I gave y'all a minute and a half. So with this scenario, what I'm taking out of here is going to be the uncomplicated vaginal delivery in the hospital, the syndactyly of the toes, the right foot specifically, and then no treatment is given, but follow-up is required. So as always, everyone either got it right on the money or you guys were on the right track. So outstanding with those keywords. Now we are going to move on to what ICD10CM guideline is going to best describe this encounter. This is going to be from our chapter 16. So this is going to be for our perinatal period, just to kind of narrow it down, because I know there are a lot of guidelines that come with what we're covering today. So again, I'll give you guys a little bit of time and then we will go over which guideline best fits this scenario. All right, that is going to be time. So the guideline that we are going to be using to find these final ICD-10 codes are going to be, again, from chapter 16, so IC16C2, and the title is going to be Coding Additional Perinatal Diagnoses, Codes for Conditions Specified as Having Implications for Future Healthcare Needs. So if you got that one right, or if you were on the right track, amazing job. And now, last but not least, we are going to reach our final part of solving this scenario. We are going to pick our ICD-10-CM code or codes that best describe this encounter, using those tools, using those keywords in that guideline, put those answers in the chat, and then we will go over it in our PowerPoint presentation. All right, if you are still working, please continue to do so. I'm simply switching over to our PowerPoint. All righty. I know this one was a little bit of a funky one. Okay. Here is going to be our scenario. As always, the keywords we're taking out of here, I won't read this whole thing, but we're taking out that uncomplicated vaginal delivery, specifically in the hospital, the syndactyly of the toes, specifically the right foot, and no treatment being given, but follow-up being required. And then also you could put the corrective surgery may be needed in the future, because that definitely indicates the guideline that we're going to use, which is going to be that coding conditions specified as having implications for future healthcare needs. And as always, if you look inside of the MCG manual, this sequencing suggestion is a big, huge help right here on the right-hand column. So our first coding suggestion is going to be from category Z38. So if we go into our ICD-10-CM manual, we will go into that category, and we will find that our first appropriate code is going to be Z38.00, which is going to be single liveborn infant delivered vaginally. And then that's going to come from the category Z38.0, which is going to be single liveborn infant born in hospital. And obviously, the infant was born in the hospital because that is a keyword that we took out of this scenario. So that helps us pick our first code. So yeah, so Z38.00, single live infant delivered vaginally. And then we go back to our guideline and we see that our second suggestion is going to be conditions or conditions specified. And so that condition is going to be the syndactyly of the toes. So we are going to go back into our ICD-10-CM manual, and we are going to find our second code, which is going to be the syndactyly is going to be web toes. And if you go on WebToes, the suggestion right here, the inclusion is going to be simple syndactyly of toes without synostosis. And so that would make it correct. And then we have to go down because it requires 5 characters. And we are going to come up with Q70.31, which is going to be web toes of the right foot, because again, that is another keyword that we took out of this scenario. So those are going to be the 2 codes that are going to best describe this encounter. So if you got that one right, outstanding job. And hopefully the explanation made sense if we had any questions about it. And I know I haven't mentioned it yet, but if we do have any questions that you want me to go into further about any of the scenarios or anything that we went over, you can always click on our survey link. I think Miss Olga has already posted it in the chat, and I'm sure she'll do it again because she's so awesome and amazing. So yes, so if you have anything you want me to go into depth or any questions that were unanswered in this class, definitely make sure to click on that link and ask those questions, and I will get back to you. So yes, so these are the 2 that are going to best describe this scenario. So outstanding job if we were on the right track or if we got those right. And I am going to stop sharing my screen again, and then we're going to move over to our Quizlet one last time, and we are going to go over our last scenario for the night. And as always, we are going to start right from the top, start from our keywords. All right. Start from our keywords. So this one is going to be a long one as well. So a 32-year-old woman gravided to Para 1 at 24 weeks gestation presents to her obstetrician for a routine prenatal visit. The provider documents that the pregnancy is considered high risk due to the patient's age of 32 and a history of preterm labor in a previous pregnancy. The patient has no current complications, symptoms, or complaints. The purpose of the visit is ongoing supervision and monitoring of the high-risk pregnancy. So, with all that being said, how are we going to shorten it down? What keywords are we going to focus on that describe this encounter? Let me know in the chat, and then we will go over it. Okay. So lots of words. What are we taking out of this scenario to kind of shorten it down? So I'm taking out that 24 weeks gestation, the high risk due to age, the age being 32, and then the history of preterm labor. And then also the purpose of this visit is supervision, specifically the supervision of the high risk pregnancy. So all of those that put the answers in the chat. Great job, great participation as always. And now you already know the second part. We are picking out our ICD10CM guideline that best describes this encounter. Let me know what we think that is in the chat, and then we will move on to our final codes. Alrighty, that is time. So the guideline that I am choosing from all of the guidelines are going to be, oh, oopsies. Pay no mind. That's not a guideline. Does it say the guideline? Oh! Hold on 1 second. That's super strange. So the guideline, hopefully no one saw that. So the guideline that we're gonna pick is going to be IC15B2, which is going to be supervision of high-risk pregnancy. I don't know why I had those codes in there twice. That's super weird. So I apologize for that. But that is going to be the code from chapter 15. So that is what we're going to be using. And then we are going to do our final code now. And I have the snippet from the guideline on the PowerPoint so we can see how that looks. So we just won't be able to see it on the Quizlet. I apologize about that. But now we are going to pick what ICD10CM code or codes that are best going to describe this encounter. And again, the guideline, the name for the guideline is going to be from that chapter 15, the supervision of the high-risk pregnancy. So let me know what we think the codes are in the chat. I'll give you guys about a minute and a half for that one. Alrighty. It is about that time. I'm going to switch over to our PowerPoint one last time and see how everything looks all together. Okay. So first and foremost, before I go over again the keywords, if anyone was curious on or if anyone was unsure about the gravida and the para wording right here, the gravida is going to be the total number of times a woman is pregnant, including the current pregnancy. And then the wording para is the number of pregnancies that have reached a viable gestational age. So typically 20 weeks or more, regardless if the infant was born alive or stillborn. So I know that that is going to be in a lot of when you're dealing with pregnancy. I know that you'll see that wording, so that's kind of why I wanted to include it in this scenario right here, just so we're kind of familiar with it. But the keywords that we're taking out of this scenario are going to be that 24 weeks gestation, the high risk due to the age and the history of preterm labor, and also the visit of the supervision, which, like we said, was going to be monitoring of the high risk pregnancy. This is going to be the guideline that I was talking about. So IC15B2, so selection of OB principal or first listed diagnosis, supervision of high-risk pregnancy. And we see right here our sequencing suggestion. Our first is going to be an 009 code. So we are going to go into our ICD-10 manual. We are going to look and see what appropriate code from that category is going to best describe this encounter. And then we see right here the right one was going to be 009.212, which is going to be supervision of pregnancy with history of preterm labor, second trimester, because this fits, the trimester that she's in. It fits, why it is a high risk pregnancy and why she specifically came to the to have treatment is the purpose of the visit, ongoing supervision and monitoring of that high-risk pregnancy. So we are not going to include the age because the age is 32. If the age was 35, as some of us know, that is going to be the age where is where it starts becoming high risk and where you can use those high risk codes because it is considered a geriatric pregnancy. But since it is just 32, we're not going to include the age as being part of the high risk and including that in our codes. So we're just going to focus on the preterm labor. And then we go back to our sequencing suggestions, and then it says to include another chapter 15 code or codes if applicable. So we're going to go down and we're going to include the weeks gestation of pregnancy. Looking at our keywords, we see she is 24 weeks gestation. So that is why we are going to select our code ZA.24 weeks gestation. All right. So those are going to be our codes that are best going to describe this scenario. So if you got that one right, or if you were on the right track, as always, hopefully that explanation made sense if we had any questions, but we are reached the end of our class. So if you have any questions about any of the scenarios, or if you just want to give us feedback on this class so we can make this class as much of a learning opportunity for everyone and make it the best possible class that it can possibly be, definitely click the link. It'll be posted again in the chat and let us know. And I will get back to you if you guys have any questions. And as always, thank you everyone for joining us, new or returning, for our Monday night class. Next week, we are going to be in our final week 8. Time is just flying by. So thank you guys so much for joining us, and we hope to see you next week. Thank you so much to my team for being such a help as always, and you guys have a wonderful rest of your Monday night.
4,000 exam passers and free classes at AMCI. Learn to coach straight from home or on the road at AMCI.